They've been abandoned by the state, and they've been forgotten about.
In Oregon, there are two ways a person with severe mental illness can be compelled to get long-term care. The first is through a process called civil commitment. That's where a patient can be involuntarily treated if they're found to be dangerous to themselves or others. The second path is through the criminal justice system. Someone commits a crime, gets arrested, and is later transferred from a jail to the state hospital for mandatory treatment. The problem is the first one, the hospital route, has all but vanished.
The system is failing to actually treat people within the non-criminal part of the system.
Oregon used to balance the types of people who could get help, some from medical referrals, others from the criminal justice system. But people in jail with severe mental illness are waiting far too long for care. And now in Oregon, being accused of a crime is effectively the only way to get mandated treatment. In 2019, a judge ordered the Oregon Health Authority to comply with a federal order and take jailed patients to the state hospital within 7 days. OHA started prioritizing criminal justice cases. These types of cases jumped to record numbers. But there are only so many beds. The health authority all but stopped admitting people who hadn't committed a crime. The data showing civil commitment in Oregon is nearly extinct. Melissa Eckstein is president of the Unity Center for Behavioral Health, a go-to source for mental health treatment in Portland. She says they used to send 400 people a year to the state hospital. Now it's just a handful.
Our treatment team is really put into a challenging situation because the things that they believe will help that person in having the most fulfilling life and being able to stay stable, they're not available to them.
Is there an option that's not the Oregon State Hospital, somewhere else you can send these patients?
Right now, there's really not.
KGW has shared these stories. Eric Gardner is now homeless after he couldn't get care. Kenny Benton couldn't recognize his own illness, only getting treatment after threatening his mom with a knife. Brett Meister was committed 4 times, but failed to get help after each release. The result is, people cycle in and out of local hospitals without lasting help. Hospitals that aren't designed to treat people with severe mental illness.
Taking up very vital, limited, community-based hospital beds.
4 of Oregon's largest hospital groups, Legacy, Providence, Peace Health, and St. Charles, sued the Oregon Health Authority, saying the state has failed to care for severely mentally ill people by neglecting civil commitments, instead warehousing people in acute care hospitals. A federal judge ruled against the hospital systems. They're now appealing that decision.
And it feels like every month that passes, we're just getting further into a hole.
Plus, Oregon increasingly stands alone. A study from the nonprofit Treatment Advocacy Center found Oregon uses just 7% of its mental health care beds for civil cases instead of criminal. That ranks last in the country out of any state that allows for civil commitment.
You are essentially creating a system where the only time that people receive care, it's in the most expensive, costly, and least effective setting.
Lisa Daly, executive director of the Treatment Advocacy Center, says we wouldn't tolerate this for any other type of health care. She asks, why should we with mental health?
If you create a situation where a person is not going to be eligible to receive care unless they have gotten into the criminal justice system, you're creating a system where care is predicated on the idea that there has to be a victim. I don't think that makes any sense, and I don't think most people would agree that they want that.